Welcome, everyone, to the Living Well with a Blood Cancer virtual conference. The Leukemia and Lymphoma Society of Canada is really proud to introduce this presentation titled Meet the Experts, How to Navigate the Side Effects of Blood Cancer During Treatment. In this 75-minute live webcast, our panelists will share information on how to manage the complications associated with blood cancers and treatment, including symptom management, nutritional strategies, sexual health and intimacy, and medication management. Before we begin, I would like to introduce myself. My name is Brooke Dewhurst, and I am the Community Services Lead here for the Atlantic region here at the Leukemia and Lymphoma Society of Canada. I will be the moderator of this online event today. We invite you to type your questions and comments in the Q&A box of your Zoom webinar panel throughout the presentations. A staff member will monitor these questions, and I will read some of them aloud at the end of the presentations. I would like to remind everyone that due to the large number of participants and limited time here today, we may not be able to answer all of the questions. Please note that our guest speakers cannot answer specific questions about your health history or status, and to please direct these questions to your healthcare teams. Lastly, today's presentation will be recorded, and so you can re-watch it again on our website. As we come together from across Canada, we recognize that we are on the lands cared for by many Indigenous nations. I personally am coming from Chibuktuk Mi'kma'ki, also known as Halifax, Nova Scotia, and I encourage you to learn about the place that you live, the land that you're on, and its history as well. We honor the First Nations, Inuit, and Métis peoples whose deep connections to these lands enrich our communities. We value Indigenous voices, and we are working to ensure they are truly represented in our leadership and staff. At the Leukemia and Lymphoma Society of Canada, our commitment to diversity, inclusion, belonging, and health equity guides how we work to support and uplift everyone affected by blood cancer. Before we present the first speaker, I would like to share a bit about how we work to support you here at the LLSC. So if you're looking for specific programs or resources but aren't sure where to find them, we are here to help you. You can connect with the community services leads in your region to receive personalized assistance and get connected to resources in your areas. Reach out by calling the toll-free number 1-833-222-4884, or you can look on our website and find the direct email and numbers to each of us. We are here to connect you to our support services as well as to localized resources based on your needs. We know that having a diagnosis of blood cancer can be very overwhelming, but know that you are not alone. There is a blood cancer community that is here to support you at every step of the way. As mentioned earlier, you can access one-on-one support to help you navigate the experience. On our website, bloodcancers.ca, you will find tailored information, including resources specific to different blood cancers, treatments. Please visit bloodcancers.ca to read, listen, and watch all of these great resources. Another way we can support you is through our Blood Cancer United Health Manager app. So it can be difficult to keep track of everyday information and tasks, medications, tracking your food, hydration, medications, and side effects. And this app helps you do all of that. And it can help you keep track of questions to ask your doctor, as well as grocery lists and meals. So please download the Blood Cancer United Health Manager app on Apple or Android to track your daily health today. And without further ado, today we will hear from our four panelists, Kylie Teggart, Taylor Rhodes, Reanne Booker, and Tina Crosby. Our first panelist today is Kylie Teggart. Kylie is a certified oncology RN and PhD student in the School of Nursing at McMaster University and conducts patient-oriented research that aims to support optimal outcomes for individuals living with cancer. She is here today to talk about symptom management. We welcome you and thank you for joining us here today, Kylie. I now turn it over to you.
Great. Thank you so much for having me and for the introduction. I'm really honored to be here today to speak a bit about a topic that I am quite passionate about, which is symptom management for patients with blood cancers. This is the topic of my PhD thesis, so I've been doing some research in this area, and I also have experience working as a nurse with patients with blood cancers. So great to see so many people on the call and really happy to be part of today's session. Next slide, please. So I actually wanted to start with the messages that I want to make sure you're leaving with today. And that is first and foremost that there is help available for your symptoms. So in my research, I've heard from some patients that they may be hesitant to report their symptoms to their healthcare team because they're not always sure if anything can be done about them. And sometimes patients may think that having blood cancer and receiving treatment means that they almost have to kind of accept a certain level of suffering. But I want you to know that we do have a lot of evidence-based strategies available for many symptoms that you could be dealing with. And before I get into those symptoms in more detail, I also want you to know that your nursing team is here to support you and that you are a key partner in your symptom management as well. And there may be some things you can be doing on your own to help improve your symptoms. So this is really what I'm hoping to highlight today. But first, I wanted to provide kind of a high-level overview of some symptoms that are common during blood cancer treatment. So a few disclaimers to start here. I'm going to review some more common symptoms that patients experience. First of all, this doesn't mean that you will experience all of these symptoms. And second of all, this isn't an exhaustive list. So the symptoms that you experience may be different based on your type of cancer or treatment, and I won't be able to get into kind of the specifics of each of those today. So I'm really focusing more broadly on kind of general symptoms, but I've also included some links to resources you can go to if you do want some more information. So starting with what are likely familiar symptoms to some of you, we know that blood cancer treatment can often affect your gastrointestinal system, so your mouth, throat, stomach, bowels, and that can result in symptoms like mucositis, which is when you have sores in your mouth or throat, which could be quite painful, make it difficult for you to eat or swallow, low appetite, nausea and vomiting or throwing up, and changes to your bowels, which could be either diarrhea or constipation. And again, I'm going to go through these symptoms at more of a high level, but through it, I've included some of the resources that are available on the Leukemia and Lymphoma Society website if you'd like to read more about any of these symptoms. So there are handouts about low appetite, mouth and throat problems, diarrhea and constipation, and nausea and vomiting as well. The next set of symptoms are often caused by changes to your blood counts, and people with blood cancer often become experts in your blood counts. So I doubt I need to explain this to you, but your treatment or the cancer itself can impact your red blood cells, your white blood cells, and your platelets. So if you have low hemoglobin, which is your red blood cells, you might find yourself short of breath, tired, winded, dizzy. If you have low white blood cells or low neutrophils, then you may be more prone to infection, which could manifest as a fever, a cough, other signs of infection. And low platelets, which are blood clotting cells, mean that you might be bleeding easier as well. And again, the LLSC has some resources about managing low blood counts and risk of infection if you wanted to read more about that. Some other symptoms you may experience are pain, and pain can be related to your cancer itself or the different medications that may be given during your treatment. You may also notice changes to your skin or skin rashes and potentially numbness or tingling in your hands or feet, which you may also hear referred to as peripheral neuropathy. And again, some resources available if you want to read more about any of those symptoms in more detail. And then finally, this is a set of symptoms that can be quite common and also quite distressing for patients, including changes to your mood. So things like anxiety or worrying or depression, low mood, fatigue, which in my research, patients actually report is the most common symptom that they're dealing with and is often undermanaged. You might also experience brain fog or changes in your thinking or memory and trouble sleeping. And a lot of these are often related or occur in what we call clusters, which means that things like fatigue and trouble sleeping often go hand in hand. And maybe you're having a hard time sleeping because you're in pain or because you're dealing with anxiety. And so these things usually do occur together, and dealing with one may actually help improve the others. And again, LLSC has some resources about fatigue and brain fog as well as trouble sleeping. So that's again a very brief overview of what you might experience. Now, what can we do about it? So symptom management is defined as the care that's given, next slide, please, to help relieve cancer-related symptoms and treatment side effects. And so that includes both the physical or the more psychological and emotional impacts of cancer. And the goal of symptom management is really to promote patient comfort. So we're really trying to figure out how can we support you to have the best quality of life during and after your treatment. And so symptom management can involve both medication or non-medication strategies. So when you think about the strategies that are available for symptom management, you might first think about those medications. So for example, pills that you can take if you are nauseous, if you're having diarrhea, if you're in pain, and those are really important and can work really well to improve those symptoms. Or you might think about things like blood transfusions, which can help support symptoms like fatigue and shortness of breath if your hemoglobin is low, also very important. But what you might not think about is kind of this whole other list, which is really a snapshot of the non-medication strategies that we do have evidence for that can help manage some of your symptoms. So physical activity is often under-recognized, but is actually one of the best strategies we have for managing cancer-related fatigue. And that might sound a bit counterintuitive, but actually resting too much during the day can actually make your fatigue worse. And so you do want to start slow and talk with your team if you're not active already. But light exercise and building up your activity can actually boost your energy levels and also may help improve your sleep, which again can kind of work in tandem to improve your fatigue. And fatigue management is often about kind of energy tracking and conservation. So thinking about how you can plan your day around your energy levels and the things you really want to engage in. What you're eating or your nutrition can also impact many symptoms. And I know we're lucky to have a dietitian on the call today who will get into that a little bit more. Things like guided meditation and relaxation or music and art therapy can help with anxiety, shortness of breath, depression, fatigue, even pain. Your oral hygiene, so strategies you can use to help prevent or manage mouth sores or dryness, things like bland mouth rinses, teeth brushing, keeping your mouth moisturized, your sleep hygiene as well. So a lot of things you can be doing to improve your routine and quality of sleep. And also really important are peer support and more formal counseling. And this can be very helpful. And there may be programs connected to your cancer centers for that. So I know the Leukemia Lymphoma Society also has some peer support programs as well. So, as far as the role of your nursing team in helping manage your symptoms, there are many different types of nurses that you may encounter, including registered nurses or registered or licensed practical nurses, depending on where you are in the country. These are often kind of the first people you interact with when you're in the hospital, who kind of take your initial assessment, maybe take your blood pressure, take your blood work, figure out what's going on with you. You might also encounter advanced practice nurses who provide symptom management. So this could be nurse practitioners or clinical nurse specialists. And these are nurses with master's degrees, so a bit more education, and also who have a specialty in cancer care. And I included a quote here from one of the patients I interviewed who was living with lymphoma in my research. And when asked about the role of nursing in their symptom management, they said they play a big part. And if you need something done, you go to the nurse and they get it done. So this can be, I think, how you can maybe think about your nursing team as your first point of contact for your symptom management. If you need something done, they're the first people you go to, and they can usually help you figure it out. So I also said at the beginning that you and your caregivers have a big role to play as partners in your symptom management care. So what can you do as a patient? First and foremost, please raise any symptom concerns you have with your healthcare team. Report your symptoms to your nurses. Again, even if they can't help you directly, they will find someone who can. So don't be afraid to report what you're going through to your nurses, to your doctors. There are often supports available or additional investigations the team can do to look into any underlying causes of your symptoms if you've been dealing things on your own for a while. So definitely your first point of contact for symptom management is your cancer care team. Um, Also, though, don't be afraid to ask your team what supports or referrals are available in your center. So many cancer centers do have dedicated pain and symptom management clinics, psychosocial oncology or supportive care departments, or connections to community resource centers that you may be able to link up with for more support if you need it. And then again, so the first step, talk to your team so they can look into what's going on with your symptoms. But you also want to know where you can find trusted resources to support your self-care or self-management of your symptoms at home. And so there are many good resources out there that get into some of the strategies I mentioned, things you may be able to do around your activity, for example, and of course, always in consultation with your healthcare team. And so on this slide, I've included some places that you can go for more information. So again, I've highlighted many of the Leukemia Lymphoma Society resources. The Canadian Cancer Society has a webpage about side effects. Cancer Care Ontario, which is where I am, has really excellent patient symptom management guides available on their website to anybody, as well as kind of trusted links to other videos or websites for each symptom that you can click on. And BC Cancer has a similar webpage as well. So these would be some great places to start to find out what is available to you and what you can be asking your team about. And so again, I just want to circle back to the take-home messages that I shared at the beginning. So I know this is a short presentation, but hopefully I've been able to share a little bit about how there's support available for your symptoms and how your nursing team can support you, and also the role that you play as a partner in your symptom management care. So I'll leave it there, but I know we're taking questions at the end and happy to get into anything in more detail.
Thank you, Kylie, for your informative presentation. Learning more about symptom management and when and how to reach out for support is so important to anyone impacted by a blood cancer. So thank you.
Thanks.
Our next panelist is Taylor Rhodes, a clinical dietitian at Nova Scotia Health, specializing in hematology and medical oncology. Taylor is experienced in developing and implementing nutrition care plans to support patient recovery and overall health. She's here today to talk about how to optimize nutrition during treatment. Thank you for being here today, Taylor, and the floor is all yours.
Thank you so much for that lovely introduction, and I'm very honored to be here with you all today. So today we're going to talk about optimizing nutrition through blood cancer treatment, and a brief overview will be then touch on why eating well is important, touch on some common nutrition barriers, including low appetite, changes in taste and smell, constipation, diarrhea, nausea and vomiting, and finally some food safety considerations. So why is eating well important? Eating well during your cancer treatment can help you maintain strength and energy, preserve your weight and muscle mass, maintain your body's stores of nutrients, better tolerate treatment-related side effects, lower your risk of infection, and heal and recover faster. Nearly half of cancer patients experience malnutrition at some point during their cancer care. So malnutrition can happen when you don't eat or absorb enough energy or nutrition for your body to function well. Malnutrition is associated with increased hospitalizations, longer length of stay, lower quality of life, decreased tolerance to treatments, and decreased survival. So please be informed that cancer and cancer treatments can cause changes in your nutrition needs. You may require increased protein and energy to help support you before, during, and after your cancer treatments. Your body uses protein to build and repair cells, heal, build muscle, and fight infections. Energy, also known as calories, comes from carbohydrates, fat, and protein in food. A registered dietitian can talk with you about your nutritional history and provide nutrition recommendations tailored to your individual needs. This presentation is a general overview, but I do strongly encourage you to work with a registered dietitian in your community. Now, going into some common nutrition barriers. Low appetite is the involuntary loss of appetite or desire to eat, which may or may not be related to early satiety, which is the feeling of being full after eating or drinking a small amount. Strategies include making every bite count by choosing foods that are high in energy and protein. Eat small, frequent meals and snacks. You can aim for 6 eating sessions a day. And you can do so by using a strategy called eat by the clock. So even if you don't feel like eating, but you've set out that you'd like to nourish yourself every 2 hours, if you do that through the course of the day, you will likely take in greater amounts of energy and protein than had you not made that plan. Have liquids in between meals rather than with meals to avoid filling up on beverages at mealtime. And if your appetite changes during the day, try to eat your biggest meal when your appetite and energy are at the highest in the day. So generally, if you were someone that had your largest evening meal, perhaps that's not what's going to work best for you at different times. And maybe breakfast might be the best. Just got to lean into what works. Engage in daily physical activity as directed by your healthcare team. So focusing on high energy, high protein food is essential to help preserving your muscle mass in addition to physical activity. I would encourage you to reach out to your physician or physiotherapist to establish a safe exercise program to ensure that you maintain as much lean muscle as possible. And if eating is difficult, use oral nutrition supplements as recommended by your healthcare team. And you can focus on foods high in energy and protein. So I briefly explained that your body uses protein to build and repair cells, heal, build muscle, and fight infections. And energy, also known as calories, comes from carbohydrates, fat, and protein in our foods. You can increase your energy and protein intake by choosing protein-rich and calorie-dense foods. Main food sources of protein include meat, poultry, and fish, eggs, dairy products, legumes such as dried peas, beans, and lentils, nuts, tofu, and soy. Here's a table that goes over some common protein foods, suggested serving sizes, and approximate grams of protein, just give you an idea. And you can ask your dietitian how many grams of protein that you should try to eat in a day. You can increase the energy density in your foods by adding sauces and gravies, using Greek yogurt or whipped cream as dip, topping foods with cheese, adding extra eggs to baking, and adding nuts, seeds to salads, stir fries, cereals, yogurts, pudding, ice cream, and baked goods. You can really get creative, and that goes back into the idea of really making every bite count and really asking yourself, how can you add more energy into the foods that you enjoy? And there are a lot of resources available to you through the Leukemia and Lymphoma Society, such as this handout on low appetite and weight loss. So I have also linked that here for you to download. So moving on to changes in taste and smell. So those can be experienced as heightened sense of metallic, bitter, salty, or sweet taste. There may also be a reduction in taste and ability to smell, or the absence of taste and smell altogether. Some strategies include keeping your mouth clean and healthy by brushing and flossing regularly, rinsing your mouth before and after meals to help clear taste buds, using a cleansing rinse. You can mix 3/4 of a teaspoon salt, 1 teaspoon baking soda into 4 cups of water, and rinse your mouth with 1 cup of this mixture 3 to 4 times per day or as directed by a physician. When smell is bothersome, you can try eating foods at different temperatures. So choose foods served cold or at room temperature. Avoid foods with strong odors, and avoid cooking areas during meal preparation, and ensure that you use ventilation in cooking areas with exhaust fans and opening windows. If a food specifically tastes metallic or bitter, you can change your cooking method by using glass pots and plastic utensils. Opt for fresh or frozen food instead of canned. Marinate meats with fruit juice, vinegar, wine, or soy sauce. Use lemon candies, mints, or gum after a meal as long as your mouth is not sore. Eat meat, fish, or poultry at room temperature or cold. And eating less red meat as it can taste more metallic than fish and chicken. If foods are salty, you can try adding sweet flavors such as cinnamon, fruit, or sugar, and opt for the lower sodium products. If foods are too sweet, you may add a pinch of salt into puddings, ice cream, yogurts, and canned fruits. Opt for nutritional supplements with the coffee flavor. Substitute buttermilk instead of milk into smoothie recipes. And try adding acidity by using lemon and lime and vinegar as long as your mouth is not sore. And if foods are bland, you could try switching between bites of foods that taste different during a meal, adding more salt, herbs, and spices as long as your mouth is not sore, and opting for stronger flavored foods like spaghetti sauce, barbecue sauce, chocolate, pickles, and marinated meats. Now moving on to constipation, which is characterized by irregular or infrequent or difficult bowel movements. So here, hydration is really important. Aim for 8 to 10 cups of fluid daily. Engage in daily physical activity as directed by your healthcare team. Include a hot beverage or hot cereal into your daily routine. And you could try adding this at the time that you would usually go and use the bathroom if there is a pattern. You may try prune juice, starting with half a cup. And increase your daily intake of fiber, particularly insoluble fiber. So there are two types of fiber, soluble and insoluble, and most fiber-containing foods do have a mix of both. Soluble fiber attracts water and turns it to gel. Soluble fiber is found in oat bran, barley, psyllium, nuts and seeds, dried beans, peas, lentils, as well as some fruits and vegetables. Whereas insoluble fiber helps increase stool bulk and may improve constipation and promote a healthy digestive system and regular bowel movements. Insoluble fiber is found in the skins of vegetables and fruit, whole grains, and wheat bran. You can aim to gradually increase your fiber intake with a goal for 25 grams per day for women and 38 grams per day for men. And when you're gradually increasing fiber, it is important to also focus on hydration and increasing your hydration with that as well. And keep the lines of communication open. Report to your healthcare team if you have not had a bowel movement in 3 days. And moving on to diarrhea, which is an increase of 3 or more stool per day as compared to usual, or an increase in liquidity of bowel movements. You can eat small, frequent meals. And again, focus on hydration by drinking at least 8 to 10 cups of fluid daily, but adding extra hydration, 1 cup of fluid for each loose bowel movement. You can eliminate or eliminate caffeine, such as caffeinated tea, coffee, and cola. Avoid alcohol, spicy, high fat, and high insoluble fiber foods. So in contrast, when we spoke about constipation, we did want to focus on insoluble fiber foods, whereas now with diarrhea, we're going to switch gears and lean more into the soluble fiber foods, which we'll go a little bit more in depth in a moment. And avoid sorbitol or other products containing sugar alcohols, such as sugar-free gum and candy. And again, focus on the soluble fiber foods, because soluble fiber helps absorb and soak up fluid, which can lessen your diarrhea. So some foods to focus on in fruits would be applesauce, bananas that are ripe, and canned fruit. And you'll notice that all of these fruits here do not have the skin, because that's where we would find more insoluble fiber. For vegetables, we could opt for cooked white or sweet potato with no skins. In the breads and pastas, focusing on white rice and products made with white flour, and cereals, opting for oatmeal, cream of wheat, and farina. Now for nausea and vomiting. So nausea is stomach distress and aversion to food with the urge to vomit or regurgitate the stomach's contents. It's very important to communicate the timing and patterns of symptoms with your healthcare team in association with your treatment cycle, medication use, and food and beverage intake, because this can really help your team help manage your symptoms best. Make small, frequent attempts at eating and drinking. Choose bland, starchy foods served at room temperature, such as crackers, dry cereal, toast, and plain rice. And it may seem counterintuitive to want to eat anything at all when you're very nauseated, but having these bland, starchy foods can help coat the stomach and actually lessen your nausea. Avoid greasy, high-fat foods and highly seasoned foods. Limit the exposure of cooking odors by avoiding food preparation areas and use exhaust fans or open windows. Avoid strong-smelling lotions, soaps, perfumes, and air fresheners. Rest with your head elevated for at least 30 minutes after eating. And time meals for when nausea medications are working their best. So you can work along with your team to understand your anti-nausea medications. Often they're best if you do take them 15 to 30 minutes before you plan to eat to set you up for a successful meal period. Overall, I would strongly encourage you to approach eating as part of your overall treatment. It's very natural to associate negative symptoms with food and eliminate them, so much so that the list of foods that you think you can have becomes very, very narrow. It is important to become open-minded and about trying the food again, because symptoms are transient during treatment, so they may continually change. And eating well during your cancer treatment may help you tolerate your therapy better and may improve cancer-related outcomes. In terms of food safety considerations, people who are having certain cancer treatments, especially chemotherapy, have a higher risk of getting an infection. This is because the treatment weakens your immune system by lowering the number of white blood cells in your body, and white blood cells help fight infections. Food safety is therefore of utmost importance to prevent the risk of foodborne illnesses. So here I have linked an in-depth handout from the Government of Canada called Safe Food Handling for Immunocompromised Individuals. And I would encourage you to please go and download this booklet. Unfortunately, for the sake of time, we don't have time to dive into it. But this in-depth resource will cover specific high-risk foods, tips for food shopping, proper food storage and defrosting methods, proper cooking methods, as well as food cleanliness. So I would encourage you to go through this and ask your healthcare team if you have any questions. And that concludes my portion for today, and I just wanted to thank everyone for their time.
Thank you so much, Taylor, for your presentation and the practical advice on how to optimize nutrition during blood cancer treatments. You know, we all need to eat, and finding the best ways to make that possible and nutritious for folks going through treatment is key, so thank you. Our next panelist is Reanne Booker, an oncology and palliative nurse practitioner with over 25 years of experience in cancer care. She currently works with the palliative care team at the Arthur J.E. Child Comprehensive Cancer Center, and she is here today to speak with us about sexual health and intimacy. Welcome, Reanne.
Thanks, Brooke, and welcome everyone. Just a quick note that I've just, as of Monday this week, taken a new position with the multiple myeloma team at the Arthur J.E. Child Cancer Center. So still a very strong interest and expertise in palliative care, but hopefully bringing that to the myeloma group. So changes in intimacy and sexual health are very, very common in cancer care, but often overlooked and therefore not well managed. Today, I'll just scratch the surface of this very complex and often complicated topic. But if you are around tomorrow, I will be delving into a lot more detail about the various components of changes in sexual health and intimacy after a cancer diagnosis. So patients will come to a cancer diagnosis often with a multitude of factors that could influence sexuality and sexual function. So recognizing that sexual function is just one part of sexuality and thinking about sexuality as a broader concept that would encompass body image, self-image, patterns of affection, social, family, gender roles, physical and emotional intimacy. So that sexual function piece is in there. And then factors influencing sexuality may precede the cancer diagnosis. So that might be things like previous experiences, religion, culture, other medical conditions. And then there is the impact of cancer and its treatment on sexuality and sexual function. And sexual function itself, we know very much relies on nervous system, so nerve function, vascular blood vessels and that, and endocrine or hormone system function. And a lot of the treatments that we give for blood cancers impact all of those different body systems. And so it can be very complicated in terms of the impact on sexual function. And then again, too, we know that there can be a huge psychosocial component. And again, some of that may precede the cancer diagnosis, but a lot of that is very much linked to the disease and treatment in particular. And so again, as I mentioned, we'll just scratch the surface today, but I really hope you can join tomorrow or at least watch the recording after. In the clinic that we had at the cancer center, we had a sexual health clinic for about 3 years before we lost our funding. But we saw a lot of changes in female sexual function and female sexuality. So a huge component to that was vulvovaginal changes. So that very often is linked to changes in hormone function that lead to sometimes a premature menopause. And that can be a lot more abrupt and a lot more intense than a regular menopause would be. And then the loss of estrogen and the impact of that on the vulvovaginal tissues can be profound. So we see things like vaginal dryness, painful intercourse, sometimes bleeding with intercourse, that can impact orgasmic function. We see a lot of ovarian failure, and for some women that can be permanent. And then there can be some disease and treatment specific changes, vulvovaginal graft versus host disease for patients who have allogeneic or stem cell transplants, so cells from somebody else, a donor. And then altered fertility, which could be a talk in and of itself for a full hour at least. And then the psychosocial component as well is very important. So as I mentioned, things like body image, self-esteem, depression, anxiety, relationship difficulties. And we know that cancer and its treatment can impact all of these different areas. And less so do we know the impact of the newer cellular therapies, such as things like CAR T-cell therapy. But certainly stem cell transplant and bone marrow transplant can have profound effects. And then for male sexuality, we also see an array of different changes. The most common issue that we would see in our sexual health clinic would be changes in erectile function. So difficulties achieving erections, difficulty maintaining erections, and difficulty with insufficient firmness of erections required for penetrative intercourse. So that was a really common change we'd see. And then we also did see diminished interest and desire. And again, sometimes that is related directly to changes in hormone function, reduced testosterone, and that kind of thing. And we do sometimes see changes with ejaculation, less commonly in patients with blood cancers and more so in patients with other types of tumors like prostate cancers and that. And then again, there can be things like penile graft versus host disease that can really impair function. And for men too, impaired fertility. And then the array of body image, self-esteem, psychosocial issues can also arise. So changes in desire. Again, there's this old kind of sexual response cycle where we used to think that it was almost a linear process where desire had to be there, and then that was followed by excitement, arousal, orgasm. But we now know that it's probably not that simple or straightforward, and that people can engage in a very satisfying sexual encounter, even if it doesn't follow all those steps in the previously described sexual response cycle. So even if that desire or interest is maybe not there at the outset, somebody might get into cuddling or touching or dancing or something, and then the arousal may come after, and the interest and desire may come after. So it's not necessarily this nice, neat, linear process, but perhaps a little bit more complex. And we know as well that there can be multiple motivators for engaging in sexual activity. Sometimes it might be pleasure, sometimes it might be desiring a closeness to our partners, that physical intimacy part. But we do know that it's not as simple as a linear, straightforward model. And certainly in the cancer context, it becomes a lot more complicated. And changes in orgasm can happen to both males and females. Often we will see diminished or decreased intensity of orgasms. Sometimes there can be increased intensity. Sometimes it will stay the same. On occasion, we can see painful orgasm, particularly if there's radiation or graft versus host disease or neuropathic pain or nerve damage affecting the genitals. And in some patients, we do see a loss of orgasm altogether. And in those patients, I would say in our clinic experience, at least, if we could fix some of the other issues that were going on for the patient, if we could help reduce the painful intercourse part, that could also help improve desire and orgasm as well. The good news, I should say, with men is you can still orgasm without an erection. So you don't need an erection to have ejaculation or orgasm. Body image, again, we did a study a few years back and found that nearly all the patients in the study reported changes with their body image. So that can be things like scars, hair loss, there can be weight loss, weight gain. There can be changes with skin, rashes, redness. I know Kylie covered some of this already earlier. And an array of different issues related to the cancer and its treatment. And in the study here, that what surprised me is all the men in the study very much acknowledged this change in body image. This was a patient who had an allogeneic stem cell transplantation. And he said, I remember the first time I looked in the bathroom or looked in the mirror when I got up to go to the bathroom, and I literally fell to my knees sobbing because I didn't recognize the person that I saw. I'm trying to fight tears off now, just talking about it. I've mourned the loss of who I was. I was stronger physically. Now I'd say I'm about 90% of what I used to be. I've got a bigger heart. Some say it's the girl blood that makes me cry so easily. So his donor was a female. But really that change in body image was profound for him. And then relationship changes as well. This can be challenging for existing relationships because there's a sudden shift in the relationship and what's going on in the relationship and a lot of stress for the couple, but also difficult for people who are embarking on new relationships and dating. So when do you disclose the cancer history? When do you talk about particular issues if there are concerns about fertility impairment and those kinds of things? That can be very difficult to navigate. And again, in our study that came up with some of the patients with this distress around dating and just finding it difficult to navigate that landscape. And for partners too, we don't have a lot of great research in this area yet, but we do know that partners may feel fearful of causing pain or discomfort during sexual activity, so they might refrain from engaging in any physical intimacy at all. The partners themselves also might feel unwanted or unattracted or even rejected due to the decreased or changed sexual activity and affection. There can be a change in the role from partner to caregiver. So all these caregiver tasks can really muddy the waters in the relationship and change that focus. And then there can be a potential worry about the loss, impending loss or potential loss of the partner. And some people might pull back because of that. And so we need more research in this area for sure, but I think a lot of education from us as nurses can really help as well to normalize the experience and to help to improve and maintain some of the other aspects that we're able to manage. And then again, to make the point too, that partners might have their own issues with sexual health concerns. And so for women going through menopause or men as they're aging, about 50% of men or so over the age of 40 will have some degree of erectile issues, even in the absence of a cancer diagnosis. And so there can be issues with sexual function in both the patient and the partner. And so how we manage these, again, we're very lucky in our clinic when we had funding. We had a couple of psychologists, myself, and on occasion we'd have a gynecologic oncologist join us and a radiation oncologist join us. And so we really came at it from a biopsychosocial approach, recognizing that we can't just treat the physical concerns. We have to think about the relational and social concerns as well. And so I would often deal with some of the physical concerns, blood work and medications and physical exam, while the psychologist would work on the communication skills with patients and their partners and dealing with some of the body image and other concerns that were identified. And again, there's a growing recognition, I would say, in the research literature about the need to really address this from a multidisciplinary approach. So looking again at some of the biologic or physical changes, looking at the relational interpersonal changes, and then perhaps there's influences socioculturally, and definitely the psychological impact as well is really important to address. Some cancer centers may have dedicated sexual health programs or clinics or clinicians. Ours right now in Calgary has a very limited kind of virtual program with occupational therapists. It's better than nothing, but I would love to see our clinic resurrected again. So again, we really think that early education and assessment of sexuality is really important, and ideally this would be something that would be discussed at various time points throughout the illness and treatment trajectories. Research shows that's not happening. We often wait for patients to bring it up, and they're sometimes reluctant or scared to bring it up. There's a lot of education we can do to provide ways to maintain intimacy and help with sexual function. I love to see more support for the partners and caregivers so that they can retain that role as partner and not have to worry so much about being a caregiver. The psychology and counseling, I think, is always very important, especially if there were pre-existing issues in their relationship, but I think it's a great idea in most cases. And then we have specific ways to help depending on what the issues are with sexual function in particular. And I'll get into that in more detail tomorrow. So for females, there would be things like dilators, lubricants, moisturizers. And for male patients, there can be things like the PDE5 inhibitors like Viagra, Cialis, Levitra. And then managing cancer treatment-related symptoms and pain, as Kylie talked about earlier, is very important as well, because these can be deterrents or barriers to sexual function and intimacy. And as I mentioned, there are specific interventions we can try. Communication is really important between the partners. This is where we had the psychologists, and one in particular, Dr. Lauren Walker, was in our clinic, which is great. And so, different ways to address these topics with partners, particularly if you're not used to having these kinds of conversations, which not everybody is comfortable talking about this with a partner. So there's a couple of examples on the screen talking about, what's important to each partner and making sure that everybody's values and goals are being heard and respected. And then, sorry, I'm not sure why that's animated. Just also to talk briefly about safer sex. So again, just as there was some mention about the nutrition and for people who are immunocompromised, this is another area that hasn't received a lot of attention in the research literature, but we know that when patients' white blood cell count is low and when their platelets, the blood clotting cells, are low, they'd be at higher risks for infection and bleeding, respectively. So there may be certain types of sexual activity that might be more risky to engage in when platelets and neutrophils are low. And so that's just something to speak with your healthcare provider about. I have heard from patients in our research studies that they were so fearful of increasing the risk for infection that they avoided even kissing or snuggling or engaging in sexual activity with their partners for months. And in one case, a patient said it was a full year. And there is no research to support that you need to abstain or avoid engaging in sexual activity. But we do have ways to ensure that we're not increasing risks to patients. And so for sure, that's the same advice would apply, that practice safe sex if engaging in sexual activity with a new partner or somebody whose background you don't know, just to be cautious that way. And then again, this slide was created by a colleague of mine and meant for, or in the context of prostate cancer, but I think it's applicable to really any disease setting, is that we don't have to always necessarily think about sexual intercourse as the end-all be-all goal. We have other ways that we can help to maintain and optimize physical intimacy and emotional intimacy. And there's lots of different strategies and activities that can be done to maintain that level of intimacy. And they need not always be dependent on erections or dependent on, vulvovaginal perfection or wellness, I would say. So if there's issues there, we can work around those. So just to make the point again, that's very common for changes in sexuality to occur after diagnosis of cancer for both the patient and the partner. There's quite a lot of things we can do to help improve sexual function and intimacy throughout the illness trajectory. I would say there's no right amount of desire, no perfect relationship, and no such thing as a normal sex life. So again, I would say speak to your care providers about options that might work for them. And if you'd like to hear more details, please join tomorrow, because I'll have more time to get in to more specific details tomorrow. So I'll stop there. Thanks very much.
Thank you, Reanne, and thank you for sharing that insight and into a topic that isn't always easy to approach or for folks to talk about. So I know your suggestions will reach many, providing some of the peace of mind as well as practical strategies for moving forward. So yes, please come back tomorrow to learn more on this topic. Our final panelist today is Tina Crosby. Tina is a clinical hematology pharmacist at the Ottawa Hospital's Ambulatory Hematology Unit. With over 25 years of experience, she counsels patients diagnosed with lymphoma, multiple myeloma, and acute and chronic leukemia. For the past 6 years, Tina has also been a hematology pharmacist at Extend Pharmacy, an oncology-focused community pharmacy in Ottawa. And she is here with us today to share some tips and insights on how to best manage blood cancer medications. So welcome, Tina, and take it away.
Thank you very much, Brooke. And I'll just make sure that I can advance the slides. There we go. Perfect. So yeah, I have the pleasure today of ending our session talking about medications and trying to give you some tips on how to get the most from your therapy. I saw this slide from one of the physicians at our hospital, and I really liked it. Hit home to me when she said, you know what, we have no control over the cards that we've been dealt, but by listening to the great speakers that we've had here today and over the week of what we have set up with the Leukemia Lymphoma Society, this is what we can do. We can control how we play them. So what I wanted to do was touch on 3 things of high level on what you can do for managing your medications during therapy. I thought we would first look at how are some ways that we can integrate your medications into daily activity, because the whole purpose of taking medications is to be able to get back to life and improving your quality of life. So how can we insert these into what you're doing already now? There's some information out there that medications and food together, we heard a lot of great information about having a healthy diet as we're going through treatment. So I want to look at some food and drug interactions that can either be positive or that could butt heads with your treatment, and go over some common examples for that to be aware of. And then lastly, there's a big medical team that's part of your care. So I wanted to highlight what are some things that you can do to help to get the most from your treatment. So the first thing I want to do is look at when you're having a treatment, what are some things that can get in the way of being able to take medication on a regular basis? We talked already about some side effects that can happen and that can for sure interfere with your routine of taking medication. But what about even the schedule itself? Like some of the treatments that we have can be fairly complicated or detailed oriented of what time you need to take what. So even looking at what you've been prescribed and seeing, is there a way that I can already fit this into what I'm doing with other medications, for example? So looking at the timing of medications that you're already taking and seeing, you know, maybe it's okay if I put this at the same time with something else that I take for my cholesterol in the morning. Or even where you are at certain times of the day. I have one gentleman that takes a medication twice a day, and what he's set up is that he said, you know what, Tina, I have the medication in 2 bottles. So my morning one is upstairs where I usually am in the morning. I was finding that in the evening one is the one that if I was going to miss something or just slips my mind to take it. So now I've got that bottle down on the main floor, down where I'm watching the news. He doesn't have any pets or any children, so we don't have to worry about somebody else getting into that second bottle that's on the main level. But for him, that's his way that, yeah, I can incorporate this in without having extra memory stress of that evening dose being taken. And then another thing that I have here is financial. So the fact of taking a treatment, but then also all the supportive medications, sometimes that's a lot of cost with everything. So for sure, check with your team, like your medical team that's prescribing things, to see, you know, am I making the most of what's available to help with costs for these medications? The Leukemia Lymphoma Society, and again, is another great resource that you can look to see, you know, am I maximizing what's out there for me for costs of medications? And the last one that I have here on the right is just making sure that you have the information that you need. So a medication, you might think, do I really need to take that every day? It's nice to know what the purpose of that medication is, or the rationale behind why I'm taking something. And that might help you convince, like, oh, okay, yeah, I can actually see there's merit in this one. Yeah, I have more of a push, if you will, to take that medication. So we looked at making sure that we have the most information wise. What I want to go over next is how that information is provided. So when I'm meeting with somebody, for example, I have, an idea in my head of what I want to be able to tell you about a medication. But I don't know if how I explained it was the way that it was intended. I often think of your kid's telephone game, and you send the message, and then you go around the room and whisper it, and then you see if the message was really what was intended when it gets back to the same person. So that can even happen on a one-on-one with the person. So I encourage you, when you're meeting with like your pharmacist, nurse, physician, dietitian, anybody on the medical team, is to take that message that's being provided to you and repeat it back to them. So making sure that, if I'm telling you that, okay, I'd like you to be able to take this medication in the morning after you eat, and then it's important to go for blood work later on, pausing at some point during our conversation and saying back to me, okay, if I'm hearing this correctly, you are telling me that you would like to take this at this time. And just so that, and this is putting the onus on me as the healthcare provider, that I have used the words and that I have given you the information that I was intending to provide to you. The other thing to look at is think back on, how do you like to learn, or how do you normally like to learn about new information? Is it something that you would like to read about and digest it that way? Is it something that you prefer to talk about and hear verbally? Or do you like watching it, say, on TV or a video or something, and using that in your healthcare practice? So if you like to watch something and visually see it, or hear it that way, say that to the person that you're talking to. Like, is there a video that I can have on this? Or do you have something on paper that I can go away and look at? Or if you like electronics. So there's so many different ways that information can be provided. And it's great if you can have two different ways of receiving that information. So if it's a combination of written and verbal, or if it's videos that you can have to supplement what you heard. So I would encourage you, when you are meeting with a member of the team, to ask for that if it's not being readily provided, if we're not thinking of it first. And when you walk away, it's nice to have a plan. So our focus today is talking about side effects. So asking those questions, like even just walking away with 3 things, like, what should I do if I have diarrhea? Or who do I call if this happens? So if you can walk away from an encounter with 3 things that you need to know, or 3 things that you need to do, then that will be very helpful for that session. Because it's hard to keep straight. Like, we have so many great therapies out there now, and you might have something that has a weekly schedule versus something that also in that cocktail is something that's once a month, or even something that's every day with a pause. So there are so many different schedules, and we're using all those medications together. It's hard to keep it all straight. And it's nice to be able to use the tools that are available to support that. We always say that when we're doing treatment for cancer, it's like a full-time job in itself. So if we can use the tools that are available, then that just helps make the job that much easier. So a lot of pharmacies will provide their medication in a blister pack if you find that would be of help for you. So by all means, never hesitate to ask. There's a lot of apps, or even on our phones now, and even in the calendar section of your phone, you can set up reminders to come up. We have somebody at work that every day at 10 o'clock, their phone does this chime, and we all know, like, okay, wherever that person is, okay, this is your chime for time for your medications. You can set up even just in your calendar or in apps to remind you to take a medication. If you're a visual person like me, you can have, especially if you have a schedule where things might start off with one schedule and then change as you go through different parts of the treatment, having a calendar of having that written out can be helpful as well. And the team would be more than happy to provide that for you. So yeah, just knowing that there's different ways out there to help to make sure that you have the schedule and confirming that you are on the right schedule for your treatments. I wanted to switch over talking about interactions. And when I'm looking at interactions, a lot of times what I'm assessing is how is this supplement or this other medication or even a food, how is this going to have an effect on the cancer in itself? So I'm thinking about, is this going to give the cancer a boost, for example? Or is this going to, do we have to worry about how the bleeding or bruising that we can normally see from the cancer itself or the medications, is this going to add on to this? We know that medications can get cleared through the kidneys and liver. So is this new supplement going to make the liver have to work harder in clearing out the things that it goes through? And then would it keep around the medication longer, that we've got more than we need in our system? Lastly, the bottom two is that when you're thinking about adding a supplement, is it from a reputable source? Like, is the company or the place where you're getting this from legitimate, that what it says that it's on the bottle is actually what it is? And even just talking about that supplement in itself, is there information out there to say that, yeah, this is worth the money and the effort that I'm doing to buy this and get this medication? I wanted to highlight, just for examples, a couple of over-the-counter medications that can be top of mind when we're thinking about blood cancers. And sometimes it can happen when your body is busy. So say like a new diagnosis, or when, say, a treatment's worn off and the cancer might be acting up again. So for example, even with pain medications like ibuprofen, naproxen, Advil, that NSAIDs family. So a person, say, for example, that is newly diagnosed with multiple myeloma, or like this is the point that they're at when they're like figuring out, oh, this is multiple myeloma, that's the cause of my issues right now. Sometimes if you were taking Advil or an NSAID and say if you were needing a lot of it for pain or whatnot, that's enough that it couldn't be overburdening the kidneys and can cause kidney failure that way. So it's something that if you are taking and you're starting a therapy, it's good to check with your team to see, is this something that I could continue to use for pain or headaches? Is there another option that you can think of as well? Because the medications, I mean, they can be great for helping to settle down pain, but they can also do other things as well, such as like hiding a fever. And we were talking about, being mindful of infection risk and being on the lookout that if I was to get sick or have an infection, hiding a fever then would take away that early warning sign that something is going on when you see your temperature rise. Vitamin C is something that, especially as we're getting closer to the winter months, is that some people like to increase the amount of vitamin C that they take, and they take it as in form of a supplement. And there's some information out there to say that some of our treatments, the way that they work as antioxidants, that some medications need a little bit of oxygen around to do their work. So sometimes things like doxorubicin, methotrexate, cisplatin, some of those, if you're having big amounts of vitamin C, might interfere with those medications doing their work. So high doses of vitamin C might be something worth checking with your team if that's something that's okay to keep in my arsenal right now as I'm doing a treatment, because that could also, like we were saying earlier about the liver, high doses could put a burden also on the kidneys, and then it makes it harder for the kidneys to clear out the other treatments that you're doing. What about foods? There are some foods out there that can slow down your drugs from being metabolized and could keep around medications a little bit longer than they need to be. A lot of times people already know about grapefruit as an interaction from their cholesterol medications. So when we talk about that as pharmacists with some of our patients, they're like, oh yeah, no, I already cut out grapefruit because I can't take it with my cholesterol medication. Another one that is in the same vein that can come up is the one here in the middle, is that you can have Seville oranges, and they're often used to make marmalade. So you would have to look at the bottle to see if your marmalade has been made with Seville type of oranges. Other types, like say clementines, navel oranges, those are all fine. We're talking about specifically a Seville orange. And that can do the same type of thing as grapefruit and just slow down your liver from getting rid of your medications. Same thing too with starfruit and pomegranate. So yeah, so it's something that's worth just to ask and talk about with your team if this is okay to keep in your diet. There were studies that were done in Japan over population studies, and they looked at how many people had leukemia, and they found that people that had incorporated green tea in their diet showed that there was less leukemia in those populations. So there's been over the years now and over the decades been a boost of people incorporating green tea in their diet to for this purpose of decreasing their cancer risk. They haven't shown that it impacts people with lymphoma or multiple myeloma, so other blood cancers, but it was leukemia was where all of this came from. But we do have some medications, like for example, bortezomib, that it can slow down and impact the medication from doing its job in fighting the cancer. Or for example, in lymphoma, when we use etoposide orally by the mouth, that can also affect how much gets absorbed. So again, it's nice just to double check with your team. Like often we have relatives that mean well and they want to suggest things, and it helps give family members a way of feeling that they're contributing and helping with your care by suggesting things. And by all means, just bring the suggestions to your healthcare team to see if that's something that would be of benefit to you. Turmeric is something that has been reported as being able to promote the cells for dying. So apoptosis means cell death. And if you are combining it with black pepper, you're able to get more of that turmeric absorbed in your system. And it's something that, you know, not everything is a negative, and oftentimes when we have an herb or supplement or plant or something that is positive, then often makes its way into therapy. But it's good to check and see if this is something that would be suitable for me. Because, for example, doxorubicin, if that was part of your treatment, then that might be hindering the doxorubicin for doing its effect. Or we also look to see, well, what is your cocktail as a whole? And are we worried about bleeding? Is this something that's going to add to that? So it's good just to check when you are thinking about initiating a supplement if this is something that's of benefit to me, because we also have information out there too that this may also help for, say, for example, in multiple myeloma, if we have cells that, you know, seem to already have become used to, for example, bortezomib, then we can see if this is something that could be beneficial to add to therapy. One resource that I like to use, and it's an app that you can certainly get, or you can go to the website, is from Memorial Sloan Kettering, for example, and they have an About Herbs app. And this is one that's nice where it has different sections where you can look and see, is this a supplement that's worth doing, or what are some precautions that I need to be watched for, or is this something that am I taking the right amount to get the benefit that I need? So this is one that you can look at and see if this helps when you're having those discussions with your teams. Because there's some things out there that we know that, yes, for example, immune stimulants. There are some supplements and foods and everything that we know that can help to stimulate the immune system. But there is some theory out there that in blood cancers, that it could actually stimulate and give the leukemia or the lymphoma a boost. And then I'd hate to undo all your hard work of your treatment that you're doing by having something that is stimulating both your immune system and the parts that we don't want stimulated as well. So my take-home message is that when in doubt, by all means ask your team, because that's what we're here for. And then to close off, I wanted to look at what are things that you can do to optimize your care. So a big thing is making sure that you're staying well as you're going through therapy. And as we're getting into our cold and flu season, when people are sick, it's great if they can, it's important to keep those connections, but if we can keep them by phone instead of coming over. So if people are not well, if you can think of, how long that I'm going to be in contact with them, where are we meeting, like what kind of space there is, it a closed, crowded space, or is it something that we're meeting outside? What's the ventilation? So just thinking in terms of infection prevention, like I think of time, space, and place of what's my risk of getting an infection. Now is the time where we have our flu vaccines, COVID vaccines, so it's a great time to make sure that you have that. And if family members are asking, what can I do? Every family member that gets their flu vaccine and their COVID vaccine is great, because even say if the flu and COVID vaccine is not something that the team said that you can go do, or they may say that, oh, timing wise, we may not expect a big response from it. If everybody else gets it, then that helps to make a shield around you. And then if we look at things that we can improve in our life, like modifiable risk factors for staying healthy with our heart, how much movement we're putting in our day. If there's things like, if you want to look at smoking to see if that's something that you can reduce, that's all things that can help optimize your cancer care. We talk about making sure that you stay well from an infection point of view, but it's also good to be aware of other things that can happen. Just the fact of having a cancer can increase the chance of having a clot, a blood clot, or some of the treatments that we have can do that as well. So being aware of that when you're starting therapies, and talking to the team about what you need to watch out for can make a big difference as well. So yeah, so I think what I wanted to end on is just know that you have a big team out there, and to ask, have you met your cancer pharmacist there? Because they're there as a drug information resource for the nurse that's on your team, physician, and for you as well. So for making sure that you have the right supportive meds, the right instructions, and the right dose for you at this point in time. So what I want to leave you with is a little bit of homework. So you've got a medical team out there, and there's a big group that are doing things for you. So the next time that you meet with your team, whether it's the pharmacist, nurse, or physician, chunk and check, like pause the conversation and repeat back. So what I've heard from you today is that I need to do this when I get home. And that really helps to make sure that you have the tools that you need for your therapy. Having another set of ears going to an appointment always can make a big difference. We had somebody that came back after and said, I heard this and my wife heard that. what's the tiebreaker? So having a printed summary revisit can often be the tiebreaker, or being able to repeat that back of what you've heard so that you both can confirm that you're going away with the right information. So yeah, so thank you for listening to me today. And if you're wondering how to get in contact with your pharmacist, you know, by all means, it can be through the chemo unit or the physician's office. If you have your label, you may see the phone number there, or you might have a way through pharmacy that you talk to your pharmacist through email or by phone or in person. And if you were going to, oh, just trying to move to the next slide to close it out there. Yeah, so if you're going to talk to your pharmacist, I wanted to give you some suggestions for things that you can ask. Even just going to them and saying, look, this is what I've been doing. Can you see, is there something there that I can optimize and maximize my benefit for what I'm doing? So thank you very much for listening, and then I think we'll have some time here at the end for some questions.
Thank you, Tina, and thank you to all of our panelists for your presentations. Navigating, the side effects to cancer treatment, both in the short and long term, is such a challenge that many in our community face. Thanks for coming today to share your expertise and making side effects a less scary topic to explore. So I am aware that we are over time, and this is recorded and will be available online after the fact. So we are going to go a little bit over and just have a few questions for our panelists and then close out the day. So if our panelists don't mind coming back on screen, I just have a couple. This first one here is for Kylie, and it is one we received earlier. The nurse's role is so important in bridging the gap. What is the most critical piece of information you need from a patient during a symptom assessment? And if you don't mind, just keeping your answer to 1 to 2 minutes.
Sure. Thank you so much for that question. That's a great question, actually. That's a really, really good question for you to be thinking about. What is the information that your nursing team needs? So I would say your nurses are pretty good at pulling the information that we need out of you. The best advice I could give, as I kind of said during my talk as well, is don't hesitate to share what it is that's bothering you. Whether you think it's small or big, just be as upfront and honest as possible. And to really, there's not kind of one critical piece of information. We just need to know what it is that's going on with you. Having your family there as well can help kind of add in any additional information. So just having that kind of honest, trusting relationship with your nurse, I think, is the key.
Thank you, Kylie. And our next question is for Reanne. Given how complex and multifaceted sexual health issues are, what warning signs indicate a patient or couple needs to move beyond self-help and seek out specialized sexual health support and therapy?
That's a great question. I think it's so individualized, and we saw such an array of issues in our clinic. Ideally, I like to be proactive with any of these kinds of concerns and issues. So I would like people to, if there was in a perfect world, there'd be a sexual health clinic or program at the cancer center, and that everybody should have, a quick introduction or access to such a clinic. I think when you start to see relationship breakdowns, stress between partners, arguing more often, if one or one of the other or both of the partners are having concerns or feeling like there's strain on the marriage, I think that would be a trigger for some counseling at the very least. And again, ideally, there would be expertise within the cancer center to help address both the psychosocial aspects and the physical aspects of the sexuality concerns. Failing that, I would say people can email experts around the country. I'm happy to take questions and help people, but yeah, I just think your relationship best, and if you're feeling that there's concern there, then that's a time for sure to get help.
Thank you, Reanne. And for this next one, I believe we could open it up to really anyone, but maybe we'll specifically focus on Taylor so you can answer a question. The question in the chat is, I think the biggest challenge is figuring out how to incorporate safe physical activities when the person is feeling unwell, and the weather is not cooperating. So maybe what are some cheap or free resources and options to get moving?
Sure. So I know that during the blood cancer treatments, the level of physical activity you may safely be able to do may change. So along with your blood count, so your team is really gonna guide you on what's safest and best for you. Speaking from my experience in Nova Scotia Health, we have a lot of free programs even available through our community health team. So I would encourage you to seek out those. So there is kind of an exercise program that is put on by a physiotherapist here. And even people with mobility issues, there's a lot of different ways to become physically active, including chair yoga and things like that. So I would say just have open lines of communication with your healthcare team to make sure you're doing so in a safe manner. But that's a great thing to want to focus on, because that, along with nutrition, can really help you preserve your muscle, which gives you really great health outcomes.
Thank you for that, Taylor. And then this last one here we have, I believe, would be good for Tina. This question is, how do you deal with chronic pericardial effusion caused by ongoing treatment with a TKI drug? If you happen to know the answer to that. If not, we can always direct folks to speak to their healthcare team.
Yeah, it's really tricky because if it's a chronic symptom that's happening over and over, it really depends on where you are in your treatment. So sometimes it might mean that you might be then looking at, can I change to a different medication, for example, and see if that makes a difference? Or if it's, how can I deal with this chronically? Maybe the question might be, how can I deal with the symptoms that I'm having, like shortness of breath and fatigue? And we saw a lot of great tips today that Kylie talked about with that. But it might mean more talking to the healthcare team and seeing if, do I have the option of changing to another medication in the same class of family? Or do I need to look at the amount of fluid that's there? And is there a role for having, say, like diuretics or water pills to help remove some of that? Or what are my oxygen? So it's something that the team would follow fairly closely to find what's the most suitable option for you.
Thank you for that answer, Tina, and thank you to everyone for coming today and answering all the questions that we had. We are going to continue to the rest of our slides and close out the rest of the session today, but yes, thank you all for coming. If you haven't already registered, there is still time to join the live webcasts on intimacy and sexuality during and after a blood cancer experience, as well as Beyond Tired, Understanding and Managing Cancer-Related Fatigue Through Physical Activity. And we really want to learn how your blood cancer has shaped your everyday life. So please take the survey Living with or Beyond Blood Cancer to share your experiences to help shape how support changes and how we shape this within our organization. So yeah, please scan this with your phone right now, or you can get it from us later. And we would like to thank Johnson & Johnson, Jazz Pharmaceuticals, GSK, Agman, and Kiowa Kirin for their support in making this event possible today. And please remember that we are here to help you. You can reach us by email, by visiting our website at bloodcancers.ca, or by calling us toll free. Please note that a short survey will be sent to all participants after this presentation, and take a moment to respond as it helps us plan future events. Again, thank you. Thank you to our expert speakers for being with us here today, and to each of you for joining us, and take care of yourself.